Okay, so this is my video on the Week 10 forum, the implementation videos that we watched on Lippincott. And the video that I chose to talk about is the video that was implementing change in their CLABSI. And so I chose this video because once I graduate, there's a pretty good likelihood that I will be working in the hospital, and I think that this topic is going to be relevant in my future work. So, the key takeaways that I took from this video was that they spent 6 months working together in a committee researching ways to implement change and reduce the CLABSI rates within their facility. I thought that 6 months was a good period of time to really gather a lot of information and really have a strong foundation on what they were going to use for their implementation practices. I thought it was important that they looked at 1 year's worth of data within their facility and then compared it to the national benchmarks and to see where they were at within that year and where their rates were going, especially within the last 6 months as they were trying to implement the new change. They composed a PICO question and then sought the help of the librarian in finding the research studies that correlate with their topic in CLABSI prevention. I thought it was really important that within their committee they had multiple representation from different departments within the hospital. They had an experienced nurse to represent the nurses on the floor. They had the librarian for the research and the journal studies. They had a pharmacist that was going to be important in medication and seeing, how often they were prescribing antibiotics for the CLABSI. The physician representation, so that there was questions that maybe would not come up within the nursing population, but that the physicians were represented with their questions. The infection preventionist, I think that was probably a really important person that they included in their committee because they had insight from a provider's point of view, but also within the hospital and the infection prevention rates. So I really liked that part of it. Let's see. The second part of this video is implementation strategies that I would use in my practice once I work in the hospital. So I liked that they used the experienced nurse within the committee and that she was a voice for the nurses to make realistic expectations for change, and that her suggestion was making it easier for the nurses to chart what they were going to be doing within the new implementation and the bundle that they would be charting on, which would end up being studied by the committee. The charting is a big part of nursing, and charting correctly is also a big part of that. And so I believe that when you are trying to implement change for the nurses, that if you make it a lot more difficult for nurses to implement the change, it brings up frustration and probably a little bit of pushback because you're, technically making the job harder, even though you're trying to make it easier with less infection rates. So I did like that part within the video. The barriers and challenges that I would anticipate and how I would address them. So I think a barrier and a challenge within this video that I saw was that the bundle was implemented all at once, kind of making it harder to pinpoint what was having the greatest effect in reducing the CLABSI infection rates. And so I think that I would set launch dates maybe for specific portions of the bundle, and then track along the way as you implement individual parts of the bundle and see where the numbers were being reduced and had the greatest impact in reducing CLABSI infection rates. So, and then looking at it as a whole, maybe setting goals and launch dates, and then having a review date once the entire bundle was implemented, and you could go back and see what was the greatest impact, and then the overall impact of the entire bundle together, and where those rates fell within reducing the CLABSI infection. So that is my takeaways and barriers and challenges and what I would implement. So thank you.